Hello, my name is Michael Bellanger, and this is my capstone and 5-year plan presentation for my baccalaureate degree at Lamar University's RN to BSN nursing program. I would like to tell you something about myself. This is my bio sketch. I first became a registered nurse with my diploma in 2003. I then obtained my associate's degree in nursing in 2004. I worked for a couple years, then I became medically surgically certified in 2006. I have 15 years of acute care experience in orthopedics, major surgery, telemetry, long-term acute care, intermediate care, and cardiovascular step-down. Presently, I work as a charge nurse in an intermediate care unit that is also a cardiovascular step-down unit. I am enrolled in the RN to BSN program here at Lamar University in my senior year. I am also a member of Sigma Theta Tau. I would like to next go over how I feel I have met the outcomes for the baccalaureate degree program here at Lamar. Student Learning Outcome 1. Humanity and Society Construct practices safe and effective holistic patient-centered care to a variety of patients and or clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. I feel I have met this through Nursing 4540, Practice Care of Communities. We did a project video which included describing community and its health resources. I also did a literature review. There was a practicum project done which identified vulnerable populations in my community, Baytown, Texas. Also, a windshield survey was done, which included a survey of the residents along with a community assessment of Baytown, Texas. There was also a practicum project planning, which included vulnerable populations' needs during a disaster. My vulnerable population was the mentally handicapped. My nursing diagnosis included resource deficits and knowledge deficits, and I also prioritized the deficits to develop a teaching plan. The teaching plan was the Practicum Project Teaching Plan 4. Also in this class, we did an environmental health assessment of our community. I identified 3 pollutants in my community and identified Superfund sites in my community and the effects on the community's health. Also, there was a global discussion post. I chose HIV/AIDS and global health organizations' roles. The outcome met was 95%. Student Learning Outcome 2. Lifespan Health Continuum Construct supports patient and or clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. Also evaluates patient-centered care for patients and or clients across the lifespan based on common and complex health needs and compromised multi-health states when considering multiple determinants of health. I feel that NURS 4620, Nursing Practice Compromised Multi-Health States, helped me to reach this outcome. In this class, we wrote a patient memoir, and where you had to read a memoir. I wrote a memoir about a heart attack victim and wrote a paper about his experience and how he can maintain and restore health and prevent new disease based on nursing diagnosis through theory and evidence-based research. My paper is titled Myocardial Infarct, Anxiety, Post-Traumatic Stress Disorder. Also, there was a community-based service learning practicum in which I found a heart disease person. He volunteered, identified resources available in his community, and identified available support groups, read through evidence-based practice research, identified teaching needs of this patient, and the teaching needs were based on how we can prevent disease, restore and maintain health. Also, there was a discussion group PowerPoint presentation of the teaching tool for the heart disease volunteer in the community-based service learning practicum. NURS 4316, Comprehensive Holistic Health Assessment, helped me to meet this outcome as well. I identified a Healthy People 2020 objective in the workplace, which was to increase pneumococcal vaccination in the LTAC where I worked at the time. Also, the Comprehensive Holistic Health Assessment with a comprehensive written narrative of the assessment and video. Outcome met was 97%. Student Learning Outcome 3. evidence-based practice, and clinical reasoning construct. It is the synthesis, clinical, and judgment in nursing practice utilizing critical thinking, nursing process, research, and evidence-based practice. I feel I've met this outcome through NURS 4550, Leadership and Management Healthcare Systems. There was an assignment, clinical applications, where I wrote a paper on fall preventions using a literature review, and I also created a project plan and created a method of evaluation to see how effective this new fall prevention theory was. NURS 4620 Practice Comprehensive Multi-Health States. We wrote the patient memoir paper, and the community-based service learning practicum activity paper included the disease process, nursing diagnosis, and developing teaching tool. Also helped me to meet this outcome. In NURS 4580 Synthesis of Professional Nurse Capstone, the discussion question on Baby Williams' story and the discussion question on the Lewis Blackman story also helped me to meet this outcome. Outcome met 99%. Student Learning Outcome 4. Patient Client-Centered Care employs safe, effective patient-centered care using theory and evidence-based findings in collaboration with patients and or clients and members of the interprofessional and intraprofessional healthcare team. I feel that NURS 4620, Nursing Practice of Compromised Multi-Health States, in which we had some discussion questions I feel were relevant to this outcome. Application of clinical reasoning, judgment, comfort, and pain management. This all involved evidence-based research. And the discussion question, supraventricular tachycardia, involved the evidence-based practice and evidence-based research. Also, implementation of this newly discovered information was placed into practice within my discussion. Discussion question 4, care of patients with compromised neurological, endocrine, and gastrointestinal functioning, helped me to meet this outcome as well. Discussion question reflection activity of a patient who had open heart surgery with complications. And lastly, the patient memoir paper and video assessment. Outcome met 96%. Student Learning Outcome 5, Professional Role Construct, differentiates multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients and or clients as member of the interprofessional and intraprofessional healthcare team. Also demonstrates professional integrity, effective communication, active inquiry, and service to the community. I feel that NURS 4550, Practice Leadership Management Healthcare Systems, helped me to meet this outcome. There was a discussion question, discuss the barriers to effective communication among staff and manager, and determine how you can overcome the barriers in the discussion. Discussion question 4, describe the culture in which you work along with cultural differences and how it affects healthcare in your community. In my community, it was primarily language as a challenge at times, and it can be a barrier that must be overcome to provide health care to the community effectively and professionally. Also, the focus insight questions, particularly 7 and 9. 7 was to identify how good handoff communication is essential to building a culture of safety. And number 9, scenario meeting with interdisciplinary committee to form a work groups using the PDSA cycle to reduce the incidence of hospital-acquired pressure ulcers. This was based on recent knowledge gained from a national conference based on the scenario. Outcome met was 99%. Here's my 5-year plan. My 5-year plan is based on the Texas Board of Nursing, which requires nurses to complete 20 continuing nursing education credits every 2 years. And the CEUs must be related to your practice area in order to renew your license. This is based on the Texas Board of Nursing 2013. Also, if you become certified and maintain your certification, it can be used towards your license renewal requirements. To maintain my license and provide safe and effective care, my 5-year plan will include the following. Complete NURS 4580 in order to attain my Baccalaureate of Science degree. maintain my certifications, medical, surgical, ACLS, and BLS. Within the next 1 to 2 years, become PCCN certified, join a committee, attend shared governance meetings, become ACLS instructor, and apply for RN3 status within my workplace. Next 3 to 5 years, apply for a master's in nursing, possibly specializing in nurse leader or management. And last but not least, mentor and precept future nurses. I thank you for listening to my capstone and 5-year plan for my baccalaureate degree at Lamar University. The next slide will show the 2 references that I used.